Thank you for joining me to hear about the work of the Q Improvement Lab and how we work collaboratively and creatively to improve care. My name is Jo and I'm the Q Insight Manager from the Health Foundation. This presentation will focus on our work to improve care across mental and physical health. An increasing number of people in the UK live with both long-term mental and physical health problems. Despite evidence highlighting how our minds and bodies are connected, the UK's healthcare system can struggle to provide effective, joined-up care that takes account of people's mental and physical health needs at the same time. This increases costs and can lead to poor experiences and worsening health outcomes. There has been increasing attention to address this issue. National NHS policy supports a shift towards integrated care and increasing access to mental health support. And there are a number of evidence-based programmes being rolled out nationally to support this aim. But when it comes to improving our health and care services to address this type of complex systemic problem, there is no silver bullet. Not only do we need more than one solution to transform care, but we also need to think much broader than the technical aspects of an intervention. We need to consider, for example, individual and system behaviours and influences, and whether the solution will work in our local context and culture or for the problems we have identified. Too often, we rush to apply solutions that have worked elsewhere without giving these points due consideration. We need a new way of working to make this the norm in health and care improvement, and this is where the Q Improvement Lab comes in. The Q Lab is part of Q, a community that brings together and supports people working in health and care improvement all across the UK and Ireland that is delivered by the Health Foundation. We work with partners on topics that encompass a complex challenge for the health and care system that warrants a collaborative approach. We recruit a diverse group of people who have a stake in the issue and provide spaces for them to learn collaboratively, to reflect and try new things in a supported environment. We use creative tools and methods, drawing our influences from design thinking as well as quality improvement. Between September 2018 and September 2019, we worked with Mind to better understand how care can be designed to best meet the needs of people living with both mental and physical health problems by focusing on the specific topic of mental health and persistent back and neck pain. Our work included collaborative research with over 100 people to paint a rich picture of what was going on. We supported 5 teams to develop and test ideas locally to try and respond to the challenges our research had uncovered. We provided tailored support and coaching to enable them to follow a design process to develop and prototype ideas. And we brought the teams together to identify common learning and to connect this to a national picture. This work was underpinned by a developmental evaluation, working with an external partner, the Innovation Unit, who embedded a learning loop methodology to ensure we could apply our learning and iterate the approach. The lab's learning highlights that while action is needed at a national level to enable widespread changes, there is a lot that is within the gift of an individual service or team that can make a big difference. The ideas that the teams came up with, which included interventions to improve patient education and staff training, are not completely new or innovative, but that doesn't mean that they aren't the right things to do or that they're easy to get right. Our evaluation highlighted how the lab's approach enabled the teams to take a step back to understand the problems afresh before moving to solutions. The teams benefited from exploring the perspectives of a broad group of people whose voices are often missed out of improvement initiatives. They understood how to work more collaboratively to explore whether the ideas address the issues they had identified. And as our participants told us, this requires a different mode of working. It can be uncomfortable, but it can also be fun. To share our learning on this topic, we produced a set of service principles and a practical guide that focuses on how to implement solutions that improve care. These aim to support practitioners to identify the most common problems that people are experiencing in their service and links to ideas about how to effect change locally. In terms of our next steps, we are continuing to work with 4 teams as they further develop and test their ideas to scale their work up. We're also turning more of our attention to the skills needed for working collaboratively and creatively to achieve change in health and care, and how we can work better in partnership to enable the conditions for this approach to flourish. Please do take a look at our website where we share the learning from this work. If you have any questions or comments, please do get in touch. And sign up to Q and follow us on Twitter to find out more about our work supporting collaborative and creative approaches to change in healthcare. Thank you.